Mr. Speaker. So today I bring you healthcare transformation, House Bill 3650, and I want to share a little bit with you about the unique perspective I get to bring this bill to you from. As part of the Special Joint Committee on Healthcare Transformation, I probably had the least amount of experience around medical issues. And that's to say that I was not an administrator in the healthcare industry. I was not a doctor or a nurse or a variety of other types of professionals that were on that committee. So I sort of brought the perspective to the committee of how can we best serve this group of people in the most cost-effective and the most efficient way with the highest outcomes. So I got to do that with a great group of people, and I'm going to take just a second to thank them. And I apologize, this is going to take a few minutes, but we have spent a huge amount of time working on this bill this session, and I think it's pretty important. And I'm probably not going to get the monikers right, and they can yell at me. But I want to first thank Representative Greenlake for his leadership as my co-chair from the House on the on the Special Joint Committee of Transformation, and Senator Monis Anderson. We've spent hours around a table trying to bring something that everybody can feel good about, and I believe we've done that. And then it got moved to Ways and Means. And Representative Kotek and myself and Senator Bates sat around a table again for many hours, continuing the process of bringing a consensus bill that would serve this body in a way that would make you feel comfortable moving forward, and we got to do that. But more than that, I want to thank all the members that were on the committees and the stakeholders that helped us work through this process. The very first meeting, as they talked about a facilitated process, I asked if one of the options at the end of this process would be doing nothing or doing status quo. And that's the position I started from, and today I'm standing here bringing you this bill with my full support and asking you for yours. So as I listened to this process and listen to the comments of all the people that are out there providing health care for people on the Oregon Health Care Plan and those people that are both on the Oregon Health Care Plan and on Medicare, what I figured out rather quickly is that Oregon does a lot of things right. We have been very innovative. We have examples around our state of coordinating health care in a way that other parts of the country do not do. So this bill, we call it transformation, but really what it is it's building on what we're doing so well already in Oregon and coordinating those efforts and trying to roll them out across the state of Oregon. We're not starting over. We're not tearing down. We're not throwing the baby out with the bathwater. We are truly figuring out best practices and a way that we can do it across the state. One of the big things you're going to continue to hear is this is a cost savings thing. We're doing it because of the budget. And in fact, that's what got us started down this path. But I want you to hear me clearly today. It's not just about the money. Matter of fact, it can't be just about the money. It has to be about providing better health care with better outcomes to those citizens in Oregon that need the state of Oregon to help them with their health care problems. And if we don't get a handle on providing better health care, there will never be enough money, and we'll never be able to balance these budgets. So again, we started out with a huge budget hole. There continues to be a huge budget hole. My hope is that through this process, we are giving those providers in our communities some tools to help manage what is going to be less money into the future. So many of you have heard a term called global budgeting. That's a new buzzword this session, and within this bill we talked about global budgeting. It didn't take me very long to figure out that we're already doing global budgeting. Our great co-chairs gave me and the other co-chairs of the subcommittee a number to budget to, so we got a global budget right at the beginning. So we knew what our global budget was. And historically what would happen is your subcommittee of Ways and Means for Human Services would set silos of funding out for all the different programs for the health care of people on the Oregon health care system, including drugs and addiction, mental health, physical health, dental health, and other programs. And we would silo that money here in this building, and we'd send it out into our communities, and we would wonder why they didn't coordinate that care very well. Well, we set up the silos here without any expectation of coordination. So this bill is a move towards the idea of better coordinating those services at a community level, not in a little room downstairs, but in your community where local decisions can be made that best address the needs of the citizens in your community, having those providers from your community making those decisions. I know, much like other people in this room, we think we know best, but really what we know best is what works in our community. I don't know what works best in the big city. I know what works in my little community, and I trust those people in my community to make that decision, and that's what we're working towards. So we started out with the term accountable care organization. Some of us didn't like that. That sounded a little bit authoritative, and that coming from the Oregon Health Authority in combination was a little bit scary. So as we listened and we listened to the stakeholders, we kept hearing coordination, coordination, coordination. So very quickly we changed to what we're going to call a community care organization. A coordinated care organization. I wanted to call it a community coordinated care organization, but I was told that was too many C's. So we dropped the one C. So it's a CCO, coordinated care organization. And again, that will be community focused, and the best decisions are going to be made at the community level. And our challenge, of course, is how we can be flexible enough to let our communities figure out a way to be innovative and do this, but to have enough restrictions that we as a legislature can feel like we're being accountable to the taxpayers and to those people that are going to receive these services. This bill attempts to start down the direction of making sure we found that balance. Between now and February, there'll be several checkbacks on several issues. And through the next several months, we'll continue to work with stakeholders, with the Oregon Health Authority, with the House and Senate Health Care Committees to make sure that we get that perfect balance, or as close to as possible, so that in February, when we're all back together, we can adopt the implementation portion of this bill and start moving down the path of providing better health care, more coordinated with better outcomes with less costs. So, healthcare transformation. A guy that has run a gas station for 20 years, run a Harley owners group for 4 years, clearly the most qualified to bring you healthcare transformation. So, that's what I've done today. I have worked with some very, very excellent stakeholders and legislators to feel very comfortable to recommend this bill with you today. I have learned an incredible amount over the last 4 months around healthcare and how to deliver healthcare services, and know that I could spend the rest of my lifetime learning and not know as much as some people. House Bill 3650 moves Oregon's public health care system towards a more fiscally efficient, coordinated care system with more local control, focusing on better outcomes for our citizens. I very much urge your aye vote, and I am sure my co-carrier will clear up any questions you may have. Thank you.